Dimitriou. It's a pleasure to be with you today. First of all, I would like to say I'm honored to be to this TCM forum, and I would like to give my special thanks to WFAS for inviting me here, and also thank you for participating and helping East Asian medicine flourish. I'm here with you today to talk about acupuncture for children and carers, the carers of these children in support structures. First of all, I would like to say a few things about our organization. Here on the left-hand side on top, you see our logo. It's the Hellenic Corporation of Chinese Medicine. This is a non-government, non-profit company that has been around since 10 years now. And we're a group of people supporting Chinese medicine in Greece. And we have different kind of things that we do. Here I have on my right-hand side Ioannis Dimitriou. He's the vice president. He has a TCM bachelor and a master's degree. And Ioannis Dimitriou, he has been offering NADA protocol to refugees and carers in various refugee campuses. Here in the background you see a picture of refugees that they were coming in Lesbos Island years before, and the conditions were really bad. So Ioannis Dimitriou was there working as a volunteer and also giving another protocol to the refugees, but also to the carers of the refugees. And on the other side here is a member of our company, Christina Maniavou. She is also a master's in TCM, and she has been also going into various refugees campuses here in Athens to give treatment mainly to women and children in these refugees camps. So this is part of the work that we do as a non-profit organization. And here is a picture of the carers of the refugees, medical doctors mainly, and other healthcare practitioners that they receive the NADA protocol. So our company also is responsible for the NADA education here in Athens, Greece, and in Greece in general, and for the application of it. So us and our students have been voluntarily applying this protocol to people in need. And here are some pictures from Greece. Greece is in the southeast part of Europe, so it's a point entry for many refugees that they come from surrounding countries mainly, to either to stay in Greece or to move further in the north of Europe. And here in this picture you can see refugee camps in Greece. And the conditions many times is really bad, especially in the beginning. Slowly, some places it's getting better, but still it's very difficult for the ones that live inside, but also for the ones that they work inside. And apart from the camps, we have other organizations like the Home Projects that they create shelters. So they create shelters and they host refugees that they are staying here in Greece. So here is a picture from a celebration that I also took place a few weeks ago. And this is where we apply our treatment. It's called Yin Yang Clinic. Yin Yang Clinic has been giving free treatment since 2017 in Athens. Every Tuesday evening there are free treatments for people that they're unable to pay for an acupuncture treatment. And it is our pleasure that recently we have been in collaboration with Home Project, and we're able to support the children, the carers of the children. So we know that acupuncture has a lot of offer to many group of people in need. And Yin Yang Clinic has been offering free acupuncture treatments to various people that need acupuncture treatment but did not have the means. And here is a picture from inside the clinic. Here is myself preparing some herbs. These are some my patients, the children from a shelter. So every week I receive children and I treat them. And at the same day I also receive caregivers of those children. And this is very important because both are stressed. The children, because they have left their home, they have left their countries, they have an uncertain future. And of course this stress is also passed into the caregivers. So we have seen that it is very important to support both, and this can help everyone. It can help the individuals, but it can also help the society. And I believe it is a very important aspect of its therapist, especially of East Asian medicine, which is a holistic medicine, to help others, basically, even the ones that they cannot give something in return. And it is interesting because here we see a card where we have written down the most frequent things that we treat to these children that you see on your right hand side. So emotional, stress, sleep disturbances, depression are very common, but also musculoskeletal, different kind of pains like headache. But some of the children, they also have more difficult things to treat, such as diabetes or ex-tuberculosis complications, etc. And the caregivers, they also suffer from emotional things, mainly the same, and not that many medical issues. It's mainly musculoskeletal. So on your right hand side you can see some of the caregivers. And it's been my pleasure to cooperate with the Chief Executive Officer of Home Project, Sofia Kouvelaki, which has prepared a video for us to see. So,
good evening from the Home Project offices in Athens. The Home Project is an NGO that provides support, protection, education, and social inclusion services to lone refugee children that arrive in Greece. At the moment, there are around 2,100 refugee children that have arrived in Greece all alone, out of which around 600 are homeless, meaning that they are in the camps, in the streets. Some of them are in detention in horrible conditions. And if a child is not placed in a shelter, she or he cannot receive any kind of service nor any information on their rights. It is this gap that we are trying to address at the Home Project. What we do is we create and operate shelters, homes, where children receive a holistic network of child protection services, meaning that we cover basic needs, medical needs, pharmaceutical needs, but also we give great emphasis on social support, mental health support, education, with the final aim of providing to these children whatever they need to become active and productive citizens in society. So the final aim of our efforts is to be able to integrate these kids into society, whether that's in Greece, where they apply for asylum if they're eligible for asylum, or in another European country where we reunify them with their families. Since the beginning of our operations, we have provided this holistic network of child protection support to more than 750 children. We have reunified 130 kids with their families, and at the moment we operate 14 homes in Athens with a total capacity of 270 children. Out of these homes are for minor girls and minor mothers with their babies. One is for children aged 5 to 12, and the rest are for teenage boys aged 12 to 18. And now we have opened the shelter for 18 plus in order to support these youngsters in their transition into autonomy. Now, in this holistic child protection network of services that we offer, the whole part of the mental health and well-being of the children is extremely important to us. So in every shelter there's a psychologist, there's a child psychiatrist overseeing all the kids, and there are also external supervisors for all of our staff that provide supervision sessions on a weekly basis. And of course, we're doing continuous trainings and capacity building in matters of child protection every month. Besides all these supportive mechanisms, there is still burnout amongst our staff, secondary fatigue, secondary trauma, because they're dealing with a highly vulnerable population of children. And what we have noticed is that very often, it's not very easy to distinguish what's a medical issue, what is a psychopathological issue amongst the children. And then the interesting thing is that very often these issues are also transferred to the staff. So what Dr. Dimitriou has been doing for us, offering acupuncture sessions on a voluntary basis for our kids and our staff, has been of extreme help for us. It has helped us enhance the creation of healing environments beyond our homes, and we have witnessed that this works in a very therapeutic way, both for the children and the staff that they receive the session. So we have been going for the past months, once a week with children and staff to Dr. Dimitriou's clinic. to receive acupuncture sessions, and the results we have seen amongst children and staff, they are really remarkable. I just want to share with you some of the data that we have collected. So specifically the children that have received acupuncture sessions are children that suffer from anxiety, chronic medical diseases like kidney disease, thyroid issues, highly emotionally sensitive, and also having to deal with the challenges of being a refugee, the legal status and uncertainty, the new environment, the new culture, the foreign language. So a lot of them have expressed anxiety disorders, sleeping disorders, constant headaches, gastrointestinal problems, and there's amongst all of them a common symptom of depression and very often PTSD. So after their acupuncture sessions, we've seen that all of their symptoms and conditions have significantly improved. But beyond that, there has been a very beneficial effect in terms of the psychopedagogical aspect of what we do. More specifically, the kids have felt that there is an individualized and cared approach in the way Dr. Dimitriou has accommodated them. They have experienced his clinic as a healing environment that offers dignity very different to the public hospitals that they have been used to. They have also said, that they have never experienced something similar before, and we have witnessed that this has enhanced their ability to be more open to new experiences, which is a very significant life skill for education. Characteristically, I'm going to share quotes directly from the children. I felt like I was being seen as an important person. This environment was totally different from any other experience I had. At the beginning, I was afraid of the needles, but I gave a chance, and now I look forward for the next session. Now, similarly, this has worked wonders with our staff as well, who also experience anxiety, sleeping disorders, constant headaches with no medical and pathological reasoning, as well as kinetic issues, specifically knee issues, back and neck problems. So after the opportunity they had, they shared that they felt like a gift was being given to them. They felt like they are being cared for by their employer. They felt like they had the opportunity to address their personal needs, not related with the working environment, in a way that their physical health is improved. We have seen how acupuncture, but also the way Dr. Dimitriou has been approaching our kids and our staff has significantly enhanced all the child protection structure that we are trying to provide on a daily basis for the children. And also it has enhanced our effort to be able to support our staff so that they are able to support the kids under our care. And we're extremely grateful to Dr. Dimitriou for this, and we hope to continue our amazing collaboration together. Thank you very much.
Yes, that was Sofia Kouvellaki. First of all, I am the one that has to say thank you, because I've been given the opportunity to give help to people that they really need it. And here I would like also to thank my teachers in China. For example, one of the oldest teachers I had, now he's not in life since few years, Master Duan Zhiliang. He has done the same during his life, so I'm basically following his footsteps. I remember telling us stories that he was going into different orphanages and he was helping with the kids. So it is an honor to serve in such a place. And what I would like to say, and the message that I would like to pass, is that acupuncture as a non-verbal treatment can help a lot in shelters, in places where there is need. So different countries, they might have different places to give help to people. And I think from the results that we have been having up to today, acupuncture can offer help both into the ones that they receive the help, but also to the ones that they give the help. So having said this, I would like to thank you for watching this, and I hope if you're a therapist that you find also a way that you can support others. I think this is important for us as professionals, but also as human beings. Thank you all.